So today's numbers, although not our highest number ever, frankly, on this sort of surge that we've been dealing with, this is our highest number to date. 11,478 COVID cases reported, widespread across the state, moving our 7-day average to 9,665. This is in the face of, frankly, what is a lower than recent numbers of tests reported. We had been reporting upwards of 200,000 tests across the state. This is in the face of lab efforts built by the state. We talked to you about our partnership with PerkinElmer, but really so many different health systems, so many different laboratory partners have really stepped up in California to provide lab testing and COVID testing so we can be informed about diagnosis, track the disease, and put our contact tracing and efforts around supporting isolation when necessary and quarantine at other times so that we can stem the tide. The governor often focuses on test positivity, accurately so. We have seen this number come up from what had been below 3% just weeks ago to now a 14-day positivity of 5% and a 7-day positivity concerning up to 5.6%. We have a goal to keep this as low as possible, to continue to test our communities, to find cases, to wrap around those cases, avoid one case becoming many. But this number is one of caution and one that intensifies our resolve to get it back under control. If you take a closer look at this 7-day positive, 14-day positivity, we knew just a couple weeks ago we were at 3.3%. We were talking to you then about how it's climbing and it's rising, and it certainly has a nearly 52% increase just over the past 2 weeks. I know the numbers, it feels like, it's just a small difference between 3.3 to 5, but it's a very significant difference in the percentage increase, which is when we focus on not just increases in rates, but this notion of rate of rise in 2 weeks to have a 52% increase is quite concerning to us across the state. Hospitals, we talk to you about hospitals all the time, that we know that 12% of today's cases will be hospitalized in 2 to 3 weeks. That helps put these numbers in context. We've seen a 63.6% increase in hospitalizations for COVID-19 over the past 14 days. Just days ago, reporting that we were just climbing over 3,000 cases in the hospital across the state. Today, over 4,500. Our ICU capacity, one of our most precious resources, that signifies not just the bed in a specialized unit, but specialized staff trained to use the equipment and take care of very sick individuals, and ventilators and all the medications and tools that help us support one's respiratory system. Those beds have seen an increase of 40.5% over the last 14 days and have climbed to just over 1,100 individuals in those beds. Just a reminder that if we look day over day, week over week, we've seen a climb, not just in the number of individuals who are hospitalized, but really in the number of new admissions coming through the front doors of emergency rooms and hospitals across the state, something that is concerning. So even though that number slowly rises on hospitals, much faster are the number of new admissions, because what I said earlier, a reminder, roughly 12% of those individuals, those cases today that test positive, we expect will be in our hospitals in 2 to 3 weeks.